In the normal empty intestinal loop, 5 distinct layers can be seen. This is an example of a short-axis view. In the center of an intestinal loop is a hyperechoic lumen containing mucus. The next layer is a relatively thick hypoechoic mucous membrane layer which produces the mucus. Next, there is a thin, smooth, hyperechoic submucosa to which the mucous membrane is attached. The submucosa contains more fibrous connective tissue and is, therefore, more echogenic than the mucous membrane layer. The next layer is a relatively thin, hypoechoic muscularis layer. The muscularis layer contains more blood or fluid and is, therefore, less echogenic than the submucosal layer. Finally, there is a thin, hyperechoic serosal surface. The serosal surface is mainly fibrous connective tissue and, therefore, hyperechoic on ultrasound. These same layers are also visible in the long axis view. The hyperechoic lumen contains mucus. The mucous membrane layer is hypoechoic. The submucosa is hyperechoic. The muscularis is hypoechoic muscle. Then the serosa is a thin hyperechoic layer. The normal intestine may contract 1 to 3 times per minute. Intestines contract less frequently than the normal stomach and are not usually very active. It is uncommon to see an intestinal contraction while making the zigzag pattern to scan the intestines. If you note contractions while making the zigzag pattern, stop and further examine the area. There are 2 forms of normal intestinal contractions. Peristaltic waves, or contractions, move ingesta in one direction from proximal to distal in the direction of the colon. Segmental contractions occur when 2 areas contract at the same time, causing a reverse movement of ingesta. This form of movement results in mixing of the ingesta for better digestion and absorption. In dogs, the transverse and descending duodenum are larger or thicker than the jejunum or ileum. The duodenum is located in the right cranial and right mid-abdomen. All 3 parts of the canine small intestine have the same ultrasound appearance. The duodenum is just larger. The common bile duct and the pancreatic duct enter the duodenum very close to the pylorus through the major duodenal papilla. The major duodenal papilla is located on the dorsal, caudal side of the duodenum and has the same appearance on ultrasound in dogs and cats. The major duodenal papilla will not be seen in every patient or on every ultrasound exam. The normal feline ileum is found in the right mid-abdomen, usually while searching for the right kidney. The feline ileum is larger or thicker than the duodenum or jejunum and does not look like the other feline intestines. In a short axis view, the feline ileum appears cuboidal in shape and can be followed directly to the ascending colon. In a long axis view, the ileum is larger than other intestines and appears to have a very thick submucosal layer. The long axis ileum can also be followed directly to the ascending colon. The canine cecum is found in the right mid-abdomen and not frequently seen. The cecum is usually found by accident when it is empty, because it does not look like the other intestines. The empty cecum looks like a pouch consisting of multiple invaginations similar to rugal folds of the stomach. When filled with fecal material, it is very difficult to differentiate the cecum from the ascending colon. This video is a short axis view of a nearly empty cecum from a 12-year-old Dalmatian with fever and anorexia due to hepatic lymphoma. This video shows a short axis, then long axis view of the cecum in a 14-year-old mixed breed dog with transitional cell carcinoma of the urinary bladder. This video shows a long axis view of the cecum connecting to the ascending colon in a 22-pound miniature schnauzer. The normal colon is usually easy to recognize because of its typical hyper-reflective proximal surface and distal acoustic shadow when fecal material is present. The wall of the colon has the same 5 layers as any other intestine, but all of the wall layers are relatively and equally thin. In small intestines, the mucous membrane layer is thicker than the other wall layers. In the dog, the colon wall is usually 2 to 3 millimeters thick. In the cat, the colon wall is 1.4 to 1.7 millimeters thick. Normal colon is usually easily recognized in the abdomen. Obstructed small intestine or foreign body of the small intestine often has the same ultrasound appearance of colon. To positively identify the colon, it may be easiest to begin with the ascending colon in the right mid-abdomen. With the transducer in a transverse position, follow the ascending colon cranially till the short axis ascending colon becomes a long axis transverse colon. Rotate the transducer to a sagittal position and slide to the patient's left side. When the short axis transverse colon becomes a long axis descending colon, rotate the transducer to a transverse position and follow the descending colon to the urinary bladder and pelvis. This video shows the same process as seen in a cat. The presence of the ileum helps to identify the starting point. The transducer is in a transverse position and will slide cranially. The colon is seen in a short axis view. The right kidney will be seen as the transducer is advanced cranially. The short axis ascending colon will become a long axis transverse colon. The transducer must be rotated to a sagittal position, and the transverse colon will be seen in a short axis view. The transducer will follow the transverse colon to the patient's left side in a short axis view. The stomach appears cranial to the transverse colon. At the patient's left side, the transverse colon changes to a long axis view at the descending colon. The transducer is rotated to a transverse view, and the descending colon is seen in a short axis view. The transducer will slide caudally to follow the descending colon. The urinary bladder is seen near the colon. This process can also be reversed by starting at the descending colon near the urinary bladder and following the colon back to the ascending colon. A measurement of intestinal wall thickness should be made in every patient. Intestines can be measured in a long axis view or a short axis view. The short axis view of an empty intestine is preferred because there is less chance for measurement or operator error. The layer of mucus has an inconsistent thickness and is not included in the intestinal wall measurement. One caliper is placed at the interface between the hyperechoic mucus layer and the hypoechoic mucous membrane layer, and the other caliper is placed on the outer serosal surface. It does not matter if you measure from mucous membrane to serosa or from serosa to mucous membrane. Note, this is a wall thickness measurement and not an intestinal diameter. In dogs, the duodenum is thicker than other intestinal loops and should not measure more than 6 millimeters in large dogs. The wall of jejunum and ileum should not measure more than 4.7 millimeters in large dogs. For cats, wall measurement of the duodenum and jejunum should not be greater than 2.7 millimeters. In cats, the ileum is thicker than the duodenum and jejunum. In cats, the wall of the ileum should not measure greater than 3.2 millimeters.